effect of sitagliptin on cardiovascular outcomes in type 2 diabetes. Hi, my name is Daniela Bustamante and I'm from Catholic University, and I'm going to talk about diabetes. Definition. Diabetes is a group of diseases with a variety of causes. The result is higher levels of blood sugar. Diabetes type 2 is the most common form of diabetes. In the diabetes type 2, our body does not use insulin properly. This is called insulin resistance. At first, pancreas makes extra insulin to make you for it, but over time it isn't able to keep up and can make enough insulin to keep blood glucose at normal levels.
Type 2 diabetes occurs when your pancreas does not produce enough insulin, and your body is resistant to the insulin that is produced. Insulin is a hormone that helps your body use blood sugar, known as glucose, for energy. Your body takes the food you eat and breaks down fat, protein, and carbohydrates for energy. During the digestion process, the carbohydrates from your food are broken down into glucose. Glucose is absorbed into the bloodstream where it is carried to cells throughout your body. A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 2 diabetes, your insulin receptors are less sensitive. Though your pancreas continues to produce some insulin, it is not enough to meet your body's needs. When your body's cells are less responsive to insulin, it is more difficult for glucose to enter the cells and raise your blood glucose level. As a person with type 2 diabetes, it is important to monitor and maintain healthy blood glucose levels. Over a long period of time, high blood glucose levels can lead to serious health complications such as heart attack and stroke, blindness, kidney failure, and nerve damage. By getting daily physical activity, eating a healthy diet, and taking your prescribed medication, you will decrease your chances of developing complications from diabetes.
Normally, the incretin hormones are released during meals from good endocrine. GIP, GLP-1, they potentiate glucose-induced insulin secretion and may be responsible for up to 70% of postprandial insulin secretion. The incretin effect is severely reduced or absent in patients with type 2 diabetes mellitus. The loss of GIP action is probably a consequence of diabetes, since it is also observed in patients with diabetes secondary to chronic pancreatitis. It won't the incretin effect, it also lost. GLP-1 secretion, on the other hand, is also impaired, but its insulinotropic and glucagon-suppressive actions are preserved. These peptides are rapidly degraded by endogenous proteases, typically peptides 4, giving a short half-life of 2 to 3 minutes.
Incretins and type 2 diabetes, discovering a new piece of the puzzle. In today's modern society, a dramatic increase in patients with type 2 diabetes indicates that an unchecked global epidemic is at hand. Pathophysiology, digestion and diabetes. Glucose is the basic fuel for the cells in the body and is provided, in part, through the process of digesting the foods we eat. During digestion, the hormone insulin is released by beta cells in the islets of Langerhans of the pancreas. Insulin acts as a cellular key, allowing the passage of glucose from the bloodstream into the cells of the body. In patients with type 2 diabetes, the amount of insulin produced by the beta cells is often insufficient. Another important hormone of the pancreas is called glucagon. Glucagon is synthesized and released by alpha cells, also located in the islets of Langerhans. When glucose levels are low and metabolic fuel is needed to avoid hypoglycemia, glucagon stimulates the liver to release glucose, which has been stored as glycogen. A closer look into the mechanisms that regulate beta cell production of insulin reveals that the ingestion of food causes the release of substances from the gastrointestinal tract. These substances include hormones called incretins. Two important incretins are glucose-dependent insulinotropic polypeptide, or GIP, which is released from K cells in the duodenum, and glucagon-like peptide 1, or GLP-1, which is released from L cells in the ileum and colon. In the pancreas, both incretins have been shown to stimulate an insulin response from beta cells. Incretins.
Diabetes symptoms. Many anti-hyperglycemic agents are licensed for the treatment of type 2 diabetes, but they were questioned about the long-term cardiovascular safety.
The cardiovascular system. This bodily system includes your lungs, heart, blood, and blood vessels, veins, arteries, and capillaries. Unlike the respiratory system that performs one essential task, this one has three main functions: transport, temperature control, and protection. Transport. The blood is part of the cardiovascular system and is used to transport various things around the body to the organs that need them, such as oxygen, glucose, water, waste, and other nutrients. This is the only method of nutrient delivery to bodily organs, so it is vitally important just by itself. Temperature control. When your body needs to cool down, for example after a heavy workout, the body will move more blood towards the surface of the skin, which, due to its constant temperature, assists the body in cooling down. This is why people appear flushed or redder after they exercise. Protection. As well as transporting and delivering nutrients to various parts of the body, the cardiovascular system also carries antibodies and platelets in order to fight off disease and clot the blood to seal cuts or wounds.
Sitagliptin is an anti-hyperglycemic drug diabetes peptidase 4 inhibitor who prolongs the action of incretin hormones, including glucagon-like peptide 1 and glucose-dependent insulinotropic polypeptide by inhibiting their breakdown. This improves glycemic control in patients with type 2 diabetes, primarily by suppressing glucagon levels and increasing endogenous insulin secretions.
Sitagliptin is a prescription medication used to treat type 2 diabetes in adults. Sitagliptin is in a class of medications called DPP-4 inhibitors. It works by increasing the amounts of certain natural substances that lower blood sugar when it is high. This medication comes in tablet form and is taken once a day, with or without food. Common side effects include upper respiratory infection, stuffy nose, sore throat, nausea, and diarrhea. For more information on this medication and all other medications, explore the RX Wiki Encyclopedia on the web or on your mobile device.
Pros and cons. Pros: it doesn't have any cardiovascular outcome and also is available in Ecuador. Cons: it has side effects: diarrhea, headache, nausea, symptoms of upper respiratory infection, and upset stomach. Issue applied in Ecuador. In Ecuador, diabetes kills 2 people every hour. In our country, the treatment with Sitagliptin is really good option and we can find it on the market like Hanuvia. Thanks for your time.